Hi, I'm Kelly Beasy. I'm a nurse practitioner, a clinic owner, and an aesthetic medicine educator with HealthCert Education. Welcome to the Aesthetic Shift, a HealthCert education podcast series for cosmetic practitioners looking to evolve, to diversify, and to future-proof their aesthetic practice. In each episode, we're going to explore core cosmetic topics like treatments, complications, ethical marketing, along with some complementary areas that you might want to bring into your scope of practice, from women's health to skin rejuvenation, gut health, weight management, and more to help you broaden your offerings and build a more resilient practice. So let's get into today's topic. Today's going to be a short, sharp little one today. We're talking scope of practice. Now, scope of practice working outside of the hospital setting can be very different, and scope of practice is something that we self-define. Now, the definition from the NMBA and the medical board is that professional activities in which you are educated, competent, and authorized to perform within a safe clinical context. That is our scope of practice. And the scope of practice differs from person to person, even working within the same environment. So the four key elements in our scope of practice that we need to consider: education, competence, authority, and context. So that means education. Have you been educated and formally trained in the area that you're practicing in with the skills or the techniques, the treatments that you're currently doing? So not just informal training where you learned from a colleague, you watched one, saw one, taught one, or you went to a conference and you saw a treatment being performed once on stage. That is not formal training, and that does not constitute education. So formal education. So that might include courses, either in person, online, something where there is a formal certificate to that so that you can then prove down the track to either APRA or whoever you need to that you have a formal education in that. So ask yourself, like, have you been accredited to perform this treatment? Are you competent? So the second core is competence. So competence, do you have the skill? Do you have the experience to do this safely? So you might not know how to do something, but you know how to do it safely. And that would include dealing with potential complications. So doing a treatment or a procedure might seem fairly simple and straightforward, but it's really about how you're going to deal with any adverse events that come from the treatment that you have done. Any of the issues that you have caused, can you then treat those? So have you been trained on how to deal with the complications, the side effects? Do you feel competent in dealing with those? Do you have the skill, the knowledge, and the expertise? Do you have the capacity to provide medications? Like, are you competent to prescribe medications if this were to occur? So for our RNs, you obviously don't have prescribing rights, so you need to work within a team that has not only the capacity to prescribe or order investigations, but the skill and knowledge in the area in which they're supporting you in. So working with someone who can provide you scripts or authority to treat for certain treatments, they need to have expertise in that area of practice. You can't have an emergency practitioner doing your medical oversight because they're not informed and educated in aesthetic medicine. So that's something to be mindful of, that the people who support you need to be also educated and competent to support you. The next key component of scope of practice is authority. So are you legally allowed to perform that treatment? So is it within the scope of practice for enrolled nurses, registered nurses, nurse practitioners, or medical doctors to perform that treatment? So we know that APRA have said that there are certain things that enrolled nurses can't treat, high-risk areas, or registered nurses can't practice independently and store medications. It's not within their authority, so they must work in conjunction with someone to have medical oversight, being a nurse practitioner or doctor. So making sure that you are fully aware of the governing bodies and the policies and procedures around those. So APRA, the TGA legislation, the Poisons Act of your state, and making sure that you are practicing within those. And then the fourth and final component of scope of practice is context. So the context in which you are practicing. So that might be solo independent practice. It might be within a bigger clinical practice where you are one of several injectors that you're working with other registered nurses, enrolled nurses, nurse practitioners, doctors, or you might be in the emergency department in a large hospital. So the context in which you practice will change your scope of practice. For example, if you were working rural or remote, you might have a larger scope of practice because of the need in that setting. But when you come back into the city, your scope of practice might decrease because the need for you to work at an advanced level is decreased because there are other specialists around. So understanding that the context in which you practice, and that comes down to your employment status, so what your employer deems within your role, that should be mutually agreeable. That is part of your scope of practice. So a couple of questions to ask yourself around scope of practice. Things like, have I been to accredited training for this treatment or procedure? Am I competent? It's not just saw one, did one, teach one, but you've actually demonstrated competency in doing something multiple times to a safe standard and that you can handle complications effectively. Are you legally authorised within all of the governing legislative components of the Australian healthcare practitioners? Are you legally authorised in terms of the medication being prescribed if you're administering medication, or the treatment being authorised by your medical oversight? And is your workplace safe? Do you have resuscitation equipment? Do you have emergency drugs? Do you have policies and procedures that are up to date and relevant to what you are treating? So making sure that you reflect every 6 to 12 months on your scope of practice. The scope of practice of your individual practice does change with time and knowledge and experience and skill. So it's not to say that your scope of practice today isn't going to change in 12 months or a couple of years, even 6 months. If you undertake further study or you change work environments, you may have a broader scope of practice. One of the things that we need to be mindful of, that scope of practice there is dynamic, so it is changing, and you have the capacity to change that yourself, but working within the confines of the context in which you practice. So for example, with registered nurses, they basically would gain competence in certain injecting treatments. They might gain competence in administering botulinum toxin, and they would work with a mentor or under supervision to gain the skill and knowledge to practice that independently and safely. And then they might choose to expand their scope of practice by doing further education and building skill and experience in dermal filler and starting with lower risk areas, and then gradually increasing their scope of practice to include intermediate and high risk areas with dermal fillers under the supervision and guidance of their mentor or whatever education platform they're using, and the work environment on the context in which they're working. Nurse practitioners, they might complete further training and add prescribing in aesthetic industry to their repertoire of scope of practice. They might choose to practice independently and support other nurses as long as that is within their scope of practice and they have the education to do so. So you can't just go from working in emergency and then all of a sudden start working in aesthetic medicine. You have to put in the time and the knowledge and the experience to broaden that scope of practice over time. And I highly recommend everyone try to find a mentor to help them do that. Having a mentor is really beneficial to help you grow your scope of practice. It will allow you to build upon your knowledge, to have someone to bounce things off if things don't go to plan. If you encounter complications, you've got someone there to support and nurture your learning. If you come across difficult cases, and mentorship can be either a formal or an informal arrangement where you see someone once a week, once a month, every couple of months, and you just go through different scenarios to help you learn and grow your knowledge and experience in that particular area. It also provides you a little bit of safe oversight if you have that mentorship relationship or even a supervisor. Making sure that your education is formalized and documented in terms of a CPD plan, so that if you were to get audited, you do have the proof of attending all of that education. And then making sure that in terms of governance, that policy, procedures, protocols, and importantly, your insurance is up to date. Making sure that that insurance fully covers everything that you offer for your scope of practice. And as that scope of practice expands, you may need to look at also expanding your insurance and making sure that that's fully covered. So with that all being said, each of our clinical roles, from nurses to nurse practitioners to doctors, we all have a similar scope of practice requirement, in which scope of practice is built on education, competence, authority, and the context in which we practice. But within our individual roles, it's slightly different. So the nurses would be practicing under the delegation or supervision of medical oversight, particularly with Schedule 4 medications, and their scope of practice would be something that was mutually agreeable with that medical oversight in terms of assessment and administering any medication, recognizing complications and escalating those complications appropriately. For our nurse practitioners, obviously they have prescribing rights and the ability to practice independently, but they should be practicing in collaboration with, a mentor or someone more senior to them or more experienced than them to, have that safe practice and somebody to guide them in further education and learning. They have a greater accountability for governance, safe systems, and then compliance, obviously, with the relevant legislation and Poisons Act. So do need to be very mindful of that. And doctors, we know we have a very broad statutory scope of practice, but it's not completely unlimited. They're still bound by competence, evidence-based practice, and the context in which they are practicing. So they can't claim to have a scope of practice in procedures that they haven't been fully trained in or competent or deemed competence in. So very mindful to, take time to recognize your own scope of practice, to maintain your formal education and documenting your CPD, and just making sure that you stay inside of your scope of practice, that you invest in expanding it carefully and build upon it so that you have not just a safe practice, but a trusted reputation. So thanks for listening, and I hope you found this helpful. Share it with a colleague who might need a refresher on scope of practice, or anyone who might be interested in their scope of practice. I know that there's a lot of confusion out there on what our scope of practice is, but in the end, it is self-determined based on those 4 key components that we mentioned: education, competence, authority, and context. So that's it from me today. Thanks for listening, and I hope you found it helpful. If you're looking to deepen or start your aesthetic medicine career, I highly recommend the HealthCert's University Assured Aesthetic Medicine pathway, or any of the other education pathways that they have. They have certificate courses. They're CPD accredited and then designed for real-world practice. So they have practical one-day workshops, and they're held throughout the year in Brisbane, Melbourne, Sydney, and Perth. They feature live demonstrations as well as hands-on practical injecting. Also, if you're ready to take things further, you can reach out and we can provide you one-on-one mentoring to, gain that skill and knowledge and broaden your scope of practice in a really hands-on manner. You choose the focus, you choose the pace, the level, and we make it practical, safe, and hands-on. So thanks again for listening, and we'll see you next time on The Aesthetic Shift.